Now, a part of health promotion, it is the screening. So, how can you make sure that if somebody's going to have that or anything like that, it is actually the screenings. So, we can pretty well measure if somebody will have dwarfism whenever in the utero, during birth, or during infancy. We're able to see that. How do we see it? It is through x-rays. We could see it through physical exams and genetic testing, growth hormones, like you see on that image, when they are able to just kind of take a look at the amniotic fluid. It is in the uterus, it's a bit difficult, but it is still doable. And also during infancy, you will see that the patients that have dwarfism are a little bit more limited in their walking, their skill development. And this is one of the limitations like we see on the bottom. So one of the limitations is delay in motor skills development. So for example, they will be hard for them to sit up, crawling, and even sometimes walking normally, since those kind of patients do have a bowing of the legs. Another thing that it is frequent and that they need to be aware of is frequent ear infections. So something they need to be aware of. And another thing that could cause continuous ear infection is, since everything is just so close to each other and they just have that difficulty, they could also get hearing loss. So something to be aware of that is that they have to make sure that they check with their doctor in regards to frequent ear checking the ears and whatnot. Also, they're prone to obesity. So the PCP and their community, they have to watch out for obesity. Also, bowing of the legs could cause arthritis, pains, and such on. Such things like that. Another limitation is sleep apnea. That's why you have surgery to take off the adenoids, so be able to breathe a bit better. And arthritis, which is basically muscle joint pain that it is caused. But of course, if you're able to determine this quickly and they have a good relationship with their primary care provider and their specialist, they're able to live a fairly normal life. So this is it for health promotions.